The main job of the lungs is gas exchange, pulling oxygen into the body and getting rid of carbon dioxide. Normally, during an inhale, the diaphragm contracts to pull downward, and the chest muscles contract to pull open the chest, which both help suck in air like a vacuum. And then during an exhale, the muscles relax, allowing the lungs to spring back to their normal size, which pushes air out. The trachea, or windpipe, which splits into two main stem bronchi. The point at which they split is called the carina. It then enters the lungs, and the right lung has 3 lobes, the upper lobe, middle lobe, and lower lobe. The left lung just has 2 lobes, the upper lobe and the lower lobe. The right main stem bronchus is wider and more vertical than the left, which is why if you accidentally inhale something big that can't get coughed up, like a peanut, it's more likely to go into the right lung than the left. The main stem bronchi then divide into smaller and smaller bronchi. The trachea and the first 3 generations of bronchi are all pretty wide and use cartilage rings for support. Of bronchi, though, the airways get more narrow, called bronchioles, meaning little bronchi, and these can stay open without the need for cartilage. Air is conducted through smaller and smaller bronchioles for about 15 to 20 generations, and collectively these are known as conducting bronchioles. These conducting bronchioles receive oxygenated blood from the bronchial arteries. The walls of those conducting bronchioles are also lined by ciliated columnar cells and mucus-secreting goblet cells. The last part of the conducting bronchioles are the terminal bronchioles, and then after that air gets to the respiratory bronchioles, which are unique because they have tiny outpouchings that bud off from their walls. These outpouchings are called alveoli, and there are about 500 million of them in the lungs. Eventually, the respiratory bronchioles end when there's nothing but alveoli. And at that point, the airway is called an alveolar duct, rather than a respiratory bronchiole. And this is the final destination of the inhaled air. The alveolar wall has a completely different structure than the bronchioles. There are no cilia or smooth muscle, and instead the wall is lined by thin epithelial cells called pneumocytes, now in the alveolus surrounded by mostly type 1 pneumocytes. On the other side of the pneumocytes are endothelial cells that line the capillary walls, which is what holds the blood. This time, though, that blood comes from the pulmonary arteries and is deoxygenated. The pneumocytes in the capillaries are glued together with a protein layer called the basement membrane. So the alveolar wall, the basement membrane, and the capillary wall is really all that separates the air from the blood. And this is called the blood-gas barrier. At this point, carbon dioxide diffuses out from the deoxygenated blood and into the air of the alveoli, which then gets breathed out. And with each breath in, oxygen enters the alveoli and freely diffuses into the blood. That freshly oxygenated blood then heads off to the pulmonary veins, the heart, and then to the body's tissues. Alright, as a quick recap. The respiratory system facilitates gas exchange. Oxygen in the air is inhaled and makes its way through the pharynx, larynx, trachea, large upper airways, conducting bronchioles, respiratory bronchioles, the alveoli, and finally the capillary to be sent to the body's tissue. Then carbon dioxide makes the reverse journey to eventually be exhaled into the world.